Evening, all students. Good evening, all to you. Today, I am here. My name is Dr. Jabeerah, and I am one of the mentors of MRCPCH-FOP and TAS. And actually, I am from MedPrep Online. Okay, so let me see who else are with us today. Okay, so good evening to all. Good evening, Dr. Ali, Dr. Binesh, Dr. Amna, Dr. Junaid, Dr. Hulud, Dr. Musab, Dr. Tatiana, Dr. Ubaid, Dr. Wish, Dr. Faiza, Dr. Harsh, Dr. Hawa, okay, Dr. Hina, Dr. Ikramur Rahman, Dr. Julia. So, yeah, and Dr. Komal and Dr. Malika. So, good evening, all of you today. Um, so today we will be going through the parts of the MRCPCH part 1. Okay. So whatever the question you have today, okay, if you want to ask me, you can keep it on the chat box, all right, and or you can ask me through the voice as well, okay, and we try to keep our session interactive, all right. So I should know that you are listening to me, all right. So among all of you who are preparing for June, if anyone want to tell me? Anyone for June, for October? Okay, something I have on the chat. Okay, okay. So yeah, I think you might be hearing me now, right? Okay, so we start with the session now. Okay, so first of all, I want to discuss that what are MRCPCH, okay, and regarding its part. All right. Can you tell me, you can hear me or not? If anybody can confirm me so that I might know that you people are hearing me. Yeah, okay. Thank you so much. All right. So, yeah. So, MRCPCH is basically a membership of Royal College of Pediatrics and Child Health, right? Okay. So, these are the exam which give you GMC actually. Okay. GMC is the working license for UK. All right, and if you clear all three parts of exam, okay, then you are going to have a GMC and then a license of working over here. Okay, if you're not choosing a PLAB route. All right. So, membership of Royal College of Pediatrics and Child have actually three parts. Okay, and three theory exams are there, and one clinical exam is there. Okay. So part one is basically divided into two parts. All right. So part one A, okay, which is the foundation of practice, and part one B. Test theory of science, okay, part 2 which is applied knowledge of practice, and part 3 which is clinical exam. All right. So you can give your theory exam in any sequence basically. Okay, not the clinical exam, but there are many queries which people ask that whether if they want to give AKP first or TAS first or FOP first or both of them. So you can give in any sequence, okay, as per your experience, okay, and your knowledge. Like if you have experience of pediatrician, okay, so you might go for AKP, okay, AKP first because this is too much of clinical based, and that is more easier for them to do this exam. And after that they prefer doing FOP and test, which is more basic knowledge. All right. So that is why they give AKP first and then FOP test. And if you don't have that much knowledge, right, and you are new to the pediatrics, then you might go for the basic exam first, which is the FOP and test. Okay, so FOP will be more clinically, okay, and TAS will be more with the basics. All right. So these are the theory exams which you have to go through, and once you ace these exams, you are done with the exam, then you are eligible to give the exam of the clinical. Uh, yeah, okay. Okay, so recommendation of for apply of the exam post graduation qualification, it's not necessary basically. On their website they have written that there should be 6 months of experience. Okay, and that could be of your house job as well, or any of the clinical setting if you have some experience, because during your registration of the clinical exam they ask you show the to give the consultant name. Okay, and because they might contact them, okay, as a reference basically, so you should have you should have that. Yes, but to to clear your exam, it you should have some knowledge. Okay, so it would be more good, but it is not mandatory and given on their website. All right. Yeah, definitely. I will be talking about the course details also. But first of all, I'm going to give you some brief review. Okay. And then I'm going to discuss about the course details that what we are providing in our course. Okay. So just wait a few minutes, and then in the next slides, we will be deeply discussing about the course. All right. Okay. So, yes, we go through this quickly. Yes. Dr. Anam, if you want to say something, or if you can please mute yourself if you're not. Okay. So, FOP tax exam happens each 3 times per year, okay, and it's held in February, in June, and in October, 3 times per year. I will be talking mainly about FOP and TAS today, okay. So, FOP TAS exam is held in 3 times per year, February, June, and October. And if I talk about the dates for 2024, so here are the dates if you want to register yourself, okay. So, two exams are held in this year because February already it's very near, so you cannot register yourself for the February. 26th June, okay, and then 16th of October. So these are the days of the calendar for the FOP test and exam. Okay, and yeah. So if I talk you about the opening of the application, so there are two dates given of the applications for 26 June. If you are applying for 26 June, so you have to apply on 8 April if you're giving online invigilation, okay, and 18 April if in the test center. Okay, you can give exam in online invigilation as well and in test center as well. Okay, but right now for 2024 they have changed their criteria that certain criteria, if you met those criteria, then you are eligible for the online invigilation. Otherwise you have to apply for the test center, and we will be discussing the criteria as well. Okay, and the closing date, if I tell you, is the 12th April 2024, and Thursday 18 for test center. All right, so these are the days to mark if you are planning to give the exam in 2024. All right. If we talk about 16th of October 2024, so in October the exam is held on 16th October, and 5th August Monday, and 15th August Thursday. So these are the this one basically, this date is basically for the online invigilation, and this is for the test centers. Oh, and the closing date will be 9 for the online invigilation, and 15 for the test center. All right. Holding 3 times per year, which will be February, June, and October. Okay, and then I was discussing about the dates. Okay, so it was 26th June and 16th of October, right? And the opening dates will be 8 April and 18 April, and 5th August and 15 August, all right? And they say that in online invigilation, you have to meet some type of criteria. And what is the criteria basically? So the criteria is this, that if there is no center available in your country, first criteria, you should meet that if there is no certain centers available in your country, okay, then you are eligible. All right, then if the test center is 200 miles away from your residence, all right, so this is the second criteria. Or if there is some health issues or any reasonable adjustment you require, so this is the third. But in all these cases they will be asking you for any like evidence of your residency. So they might ask you about utility bills which could be dated within 3 months, or any tenancy or mortgage mortgage agreement. All right, so you have to provide these before you apply for the exam. So they will be doing confirmation checks and everything, that are you eligible or not, because in test centers the seats get booked too quickly, so people want to do the online invigilation. So but they have so much of load now. They have put the criteria that you meet, you should have these problems. If you have these problems, then only they will be telling you that okay, you are eligible for the online invigilations. All right, okay, coming to the another slide. Country, not country, city. And for the city, that your house should be more than 200 miles from the center. So if you give the evidence that your house is like the center is in your city, but your house is very far away, that you cannot reach. All right, so in that case only they will allow you to give the online invigilation. Okay, now before applying for the exams, this is the most important slide, and you must note down this, that before applying for the exam you need to make RCPCH account. So go to RCPCH account, okay, and make your account over there. All right, after making account, you will be coming through the registration form. You have to register your form. All right, you have to put all of your details, personal details, and they will be asking you to upload some of the documents. And the most important documents will be your degree. First of all, if any name changes, or if anything like some of the girls, if after marriage they have name changes problem and surname changes problem, so you can provide another additional documents, and you can ask or email RCPCH exam also, so that if this is the case, then what documents you should need. All right, so this should be at least 10 working days before the application windows are open. So remember, like if the dates are open, then you are not able to register yourself. Registration you can do anytime, okay, whether you're taking exam in this year, in next year, or whenever. Just register yourself, okay, and then only when the registration is done, okay, and RCPCH is emailing you, all right, and they are saying that now you have been registered. After that, when the windows open, then only you are able to book your test. If you're not registered, remember that you will not be able to apply for the test. Yes, I can guide that, but because right now I can't do there is a specific way to check. There is a specific window. Dr. Aksa also have one of the mentor of our MedPrep, or has also made one video which shows that in which portal you have to upload the degree. So what I can do that after this session, all right, so I can show that where to put the degree. All right, on the group we can send that. All right, so I will show you that where to put degree. Okay, all right. Okay, so yes, so registration is very important, because I know some people which are in our own courses as well, that they failed to apply for the exam because they didn't register themselves. Okay, and they registered themselves just 2 days before the windows open, so that was of no use totally. Okay, so it should be before 10 working days before the applications of the windows. Okay. So, if I talk about fees of FOP and test exams, so those people who are giving exam in UK and Republic of Ireland, okay, so the exam fees are different for them, and for overseas people, the exams are different for them. So, exam fee for the UK, if you are giving only FOP or TAS, so it is 365 pounds. All right. If you're giving both together, okay, so it's 620 pounds. All right. AKP is 620 as well, but right now we're not discussing AKP. So these are the exams. So you can appear as a single exam, or you can give both exam as per your priority, what you want to give. So this is for the people who are in UK or Republic of Ireland, or want to come in UK and Republic of Ireland and want to give in the center of the UK. So these are the fees of the UK. Then, if we talk about overseas, which include Jordan, Kuwait, Malta, Okay, so yes, I will be coming towards this as well. All right. I suggest that if you have time, like if I prefer, if you do not have pediatric experience, so just keep 4 to 5 months for both of them. Okay, and just study them together. Okay, we'll be coming on the preparation as well, because I have some details for this, that how to prepare for both. All right. So yes, so you can give both as well. And if you do not want and you have less time, so like if you suppose if you have only 3 months time, then go for FOP. Okay. Otherwise, because these tests are very much overlapping to each other. Okay. So I would recommend to give the exam together. It will be more easier, but keep the time more. All right. Okay, so yes, overseas people, yeah. So Jordan, they have overseas center in Jordan, Kuwait, Malta, Qatar, Sri Lanka, Pakistan, Trinidad currently only provide RCPCH theory exams. Okay, so if they're talking about India, Egypt, Malaysia, Nepal, KSA, UAE, Oman, Myanmar, Sudan, Singapore provide both theory and clinical exam test centers. So these are only for the theory exam, and these are for the theory and clinical exam centers. So one of you is asking about the Iraq. So Iraq people, if you do not have center in your country, right, so you might so you can travel through the country which is near to you, or you can apply online invigilation mentioning them that you do not have any center over there. All right, and you can provide your, as I already told you, that you can provide your residency proofs and everything, so they will be making you eligible towards the online invigilation then. All right. Okay, so if we talk about the overseas fees, so overseas fees, we have foundation of practice for single paper, we have 455 pounds. Okay, and theory and science, we have a single paper as 455 pounds as well. If you are giving both papers together, so 755 pounds. Okay, and for AKP we have 870. So these fees basically for the online invigilation as well, whether you are giving from Pakistan. Okay, so these fees in Pakistan in test center or in online. Okay, so the fees will be same for both if you're giving from Pakistan. So these are the fees for FOP and test exam if I talk about the overseas. Okay, coming to Hong Kong. Okay, so Hong Kong, they have given in Hong Kong dollars. All right, so they are $4,700 for each paper, and if they are talking about two, so that is 7,600 Hong Kong dollars. So this is about Hong Kong. So this was the fees. All right, then fees of like payment. If we talk about payment, so a lot of people having a problem in doing payments. Okay, so if we talk about payments, so it should be a credit or debit card. All right, through debit or credit cards, and no checks and drafts acceptable. Secondly, payment will be in UK pounds. Okay, so should consider about the currency fluctuations and the currency rates. Okay, they might fluctuate when you are paying. Okay, especially for the overseas people, not the UK people. So the deduction of the amount will be in UK pounds. Okay. All right. Now coming to the exam itself. So FOP exam is of 2 hours and 30 minutes. Okay, and it's in the morning. And because FOP and TAS exam is happening, both exam are occurring on the same day. But in the morning they take FOP, like suppose from 10 a.m. to 12:30. If we talk about the UK timings, all right, and then afterwards from 1 or 1:30 to 2:30, time differs every time. So then the test exam happens. Okay, so if you are giving both the exams on the same day, so not to worry, because you will be having half an hour or something break in between. In the morning FOP exam will be there, and in test exam will be in the afternoon. So if we talk about the questions, okay, so question is 6 extended matching questions. Okay, so we will be having a 7 to 8 options in that. Yes. Okay, so six extended matching questions. Okay, so extended matching questions are basically we will be having more options, like 7 to 8 options, and underneath that we will be having approx 3 questions. Okay, and for each you have to select from those 7 to 8 questions. So these are basically extended matching questions, which comes in the exam initially from question number 1 to 6. Okay, those are the extended matching questions. Then coming to the 79 single best answers. So this is the choose the best answers, which will each question will have A, B, C, D, and you have to choose one. So those will be 79. So total marking will be from 100. Okay, and they will be in front of each question, they will be showing you whether the question contains 1 mark or 1.5 mark or 2 mark. Okay, so they will be mentioning that. All right, most probably you will be having one question for 1 mark, and there is no negative marking in this exam. Okay, TAS exam, it is also of 2 hours and 30 minutes time in the afternoon. Okay, 10 EMQ questions in TAS exam and 70 single best answers, as I have already discussed. Okay, so in these exam, you have to pass each exam separately. It is not like that FOP and TAS we will combine together and make the average and then you will pass. No, you have to pass your FOP exam separately and you have to pass your TAS exam separately. Okay, passing marks varies every time. It changes every time. Okay, according to the percentages. All right, normally it remains in between 62 to 65, and test exam even more low sometimes. All right, but keep in your mind that you have to get like 62 to 65 marks to get pass. All right. Okay, coming how to prepare for FOP and test. So any questions for the previous slides? So let me know. So I move forward for the preparation and key tips and the structure of the exam then. Okay, what documents needed? Yeah. So documents basically, you have to upload your degree. Basically they are asking only for your degree, not more than that. Other than that, if you are talking about the online invigilation, okay. So in online invigilation, you have to show your utility bills, okay, or you have to show your tenancy agreement, okay, for the proof that you are very far away from your from the center. Okay, so those will be the documents. And if in case there is some name change problem, surname change problem, then you have to show your marriage certificate or something like that. Then you can email RCPCH directly to ask them that this is the matter and what documents is required. So they might ask you to upload that. So it's very easy. They reply very soon and quickly. They are very responsive. So any queries you can directly email them and they will ask you. Okay. Yeah, MBBS degree only. Yes. No, no, any other degree. The main degree, the MBBS degree. That's it. Okay. Okay. What is EMQ? So already I told you that it is the extended matching questions. Like in single best questions, we have one stem. Okay. And we have four options, right? But in EMQ questions, what we are having, we are going to have more options, like 9 to 10 options they are going to give you, or eight answers they are going to give you. And then afterwards, they are going to give you three stem of questions, which will be similar. Okay, which will be similar. Then you have to choose from those eight that which one goes with what. All right, so this is the extended matching question. So if you know the answer, so whether it is EMQ, whether it is single base question, so no difference, nothing make difference. If your bases are strong, okay, then whatever type of question they are giving, that is perfectly all right, you can go through easily. All right. Okay, so if I talk about books, okay, so what are the books for FOP and what are the books of test? So multiple of like most of the people are asking about this and queries. Where can we buy guideline books? Okay, so I don't know about your country, but yeah, you can check Amazon. Okay, and if you can't, there are a lot of PDF files of in our group also. If you check the file group of say, our groups, okay, file section of our group, so we have uploaded all the books. Okay, all the PDF files are there. If you can easily like print out those, so that will be more easier for you. Okay, and one more thing, that these guideline books doesn't have all the guidelines with them. Okay, there could be other guidelines as well, you need to find out. So for that, what you have to do, you just write a NIC website, okay, and search there about the guidelines or UK guidelines. So it will be in front of your laptop or in front of your screen, so you can use that as well. All right. So that is the authentic, basically, that is the authentic website. Yeah, definitely. Because in the groups we have the PDF files of all the books already there, whether Telegram group or whether the WhatsApp group. Just the problem in the WhatsApp group is that if you recently joined the WhatsApp group, then you are not able to see the PDF files. So you can go through our Telegram group, okay, and there is all the books already uploaded. You can get those books, and if you can print out those, and or if you want to use as a soft copies, you can see them. uh, Other guidelines, okay, so you have to search the web for that. Yeah, definitely. Okay, so admin, if you can please share the Telegram link and WhatsApp group link over here. Okay, so they can join and see the files, all right? Okay, so yeah, so if we talk about books, so we have Illustrated Book of Pediatrics. Okay, this book for FOP I'm talking, all right? So Illustrated Book of Pediatrics, which is this, okay, and Science of Pediatrics, which look like this. Okay, these are the two books. These are two textbooks. Okay. Apart from this, the RCPCH clinical cases of FOP. So this is the book clinical cases, and other books we have neonatal guidelines and we have the pediatric guidelines. All right. So a recommendation is to use the 2022 to 24 and 2022 to 24 for the pediatric as well. These are the guideline books. Not all the guidelines you have to do. There are some specific and important guidelines which has repeatedly asked in the exam. So those guidelines only you have to go through. Okay, thank you. So admin has already sent the link for the WhatsApp, and if you can please share the Telegram group also, so that will be easier for them to take the books, the PDFs of files. All right. Okay. So yeah, so illustrated textbook of pediatric, science of pediatric, clinical cases of FOP, bedside pediatric guidelines, bedside neonatal guidelines. Okay, very important. Okay, practicing previous exam questions, which is known as recalls. Okay, these are very important. You have to go through them definitely. MRCPCH sample papers which are given on their website, you can download them. Okay, if you have time, you can go through them as well. Okay, but the major book, okay, if I talk about major book for FOP is the Science of Pediatrics and the Illustrated Book of Pediatrics. All right, these two are the main theory books. Okay, side by side, you have to study the clinical cases as well. Okay, you have to go through the guidelines as well. So I will be telling you that how to approach for the for the studies as well after the books for tests. Okay. Yeah, I will tell you how to practice them and how to keep your studies goes. Okay. So how to prepare for FOP and TAS. So book for TAS basically. So for TAS is basically the basic exam which include physiology, pathology, all right, the embryology, anatomy, and all that. Only the basic knowledge. Okay, for that in TAS exam they are not asking about any guidelines. All right, so two books, main books for TAS is Science of Pediatrics, which will be which you will be reading for FOP as well, and the clinical cases for TAS. Okay, these are for the TAS. Okay, so these are two main books which you are going to do for TAS, and again practicing previous exam questions and MRCPCH sample papers. Thank you, Ali. Okay. So, yes, so these are the books that you have to go through. Now, I will be coming that how to approach for your studies, how to prepare, your exam, how to go through these books, study approach. All right. Yeah. So study approach is basically if you don't have previous experience, first of all, you need at least 3 to 4 months for each exam. If we talk about like separate exam, like 3 to 4 months for FOP and 3 to 4 months for TAS exam. But if you are giving both together, all right, then keep 4 to 5 months. Okay. And if you're like taking course, then 3 to 4 months are enough, because if we are giving course, so we are providing the materials, and we are already made all the notes. Okay. And they are such made that you do not have to dig the big books, because digging big books and finding the questions takes a lot of time. All right. So if you go through our course and you are taking our course, then I think 3 to 4 months, maybe 3 months are enough for, preparing. Otherwise, if you're not taking any course and you want to go for the exam and you do not have any pediatrics, uh, you don't have pediatrics experience, okay, then I would recommend to keep at least 3 to 4 months for one exam. All right. And if both, then 4 to 5 months. So somebody asked me that whether to go to FOP or TAS separately or both together. See, as I have already mentioned the books, so you can see the books also are overlapping each other. They have same topics. The difference in TAS and FOP is that they are asking about the same topics, but in TAS they are asking about their basics, okay, like their physiology, like their pathology, okay, what is the reason, what is the type of defect, okay. And in FOP they are asking about the clinical features. They will give you clinical scenario and they will ask what is the diagnosis, what is the best investigation. Okay, so such kind of things. Okay, so that is why I recommend that please study side by side so that you can easily go through each topic, and it will be more easier for you to go through TEST and FOP both. Yes, previous questions are also present in our group. The link has already sent, okay, and there we have all the previous recalls present. Okay, so you can see them, you can download them and use them. Okay. Okay, so what will be your study approach? So study approach will be basically go through chapters system wise along with the recalls previous questions. Okay, so the first step would be, because when you will open your recalls, yeah, you or open your previous questions. So when you will read question, you will not understand a single word that about what they are asking. Okay, which topic they are asking. You are not going to understand anything. Okay, so for that reason, go through the chapters also, start the chapter, reading of the chapter along with the recalls. We have categorized recalls as well, okay, according to the chapters, like cardio separately, respiratory separately, not for the test, but for the FOP. So that is why I recommend to go through FOP first. Okay, so go through FOP chapters, okay, do the recalls along with the chapters, okay. Or for FOP, open illustrated book, okay, open SOP book, okay, and clinical cases book, and then the guidelines. So you have to take all things together. Suppose if you are doing cardiology, okay, so just open the cardiology chapter from illustrated and open the recalls. So whatever the topic in recalls is there, just give a read from the illustrated test book, okay, and then the same topic you can read from SOP book, okay. After that, clinical cases are also so divided that I will show you. I have given some examples what clinical cases are related to CBS and what clinical cases are related to other chapters. So you can go through the clinical cases. So such a way, you will be completing illustrated as well, SOP as well, and clinical cases as well. Coming to the guidelines, so not all the guidelines you have to go through, only some questions they are asking about the guidelines. There are specific guidelines for each chapter. Okay, you need to do them. Okay, so you can write down that okay, this has been asked as a guideline, so you can make your own notes. Okay, that what topics have been asked in which chapter. So this is the approach how you're going to study for FOP and TES. No, past test is something different. Past test is basically subscription of the past test, that is different. Okay, and usually recalls are different. Recalls are those which are previous exam important questions. Previous exam important questions are recalls. Okay, and past test is different. Okay, so exam is mostly from the previous important questions. All right. Okay. Uh, yes. So, all right. So where were we? See, we are not doing past test, and it is not it is not under us basically. Past test, we are not doing past test. Okay, and exam hardly come from past test, to be honest. Okay, so no past test. Yeah, but like recalls, if you say so, recalls are the previous important questions which are given in the files. Yeah, so recalls you can get from the link which is shared by the admin. So I will tell the admin to pin that message. Okay, so admin, kindly, if you can please pin that message for the link, because a lot of people is asking for the link for our group. Okay. Okay, after doing IMMPs, I should go for AKP or FOP and TAS separately or alone. Okay, so if you have done your IMM already, so I would recommend you to go for AKP. Okay, and when once you are done for with your AKP, FOP will be very easy for you. Okay, and just you have to go through some basics, and then you can read the test as well. All right. So for those who have pediatric experiences and they have given some of the exams, so they can go for AKP first. Okay. All right. So yes, all right. So when we covered the illustrated SOP clinical cases and guidelines, what you are going to do, that you are going to read from each book and just gather the important points. How you're going to know the important points? Those important points will be basically present in the previous questions. The points they are asking again and again and repetitively, so you are going to highlight them, and any points from other book you are going to add in your main book. Okay, so that means that you are going to make your own notes. If you have time, you can make your own notes. Okay, or you can add those points in your main book, so that in the end, because in the end, things are very haphazard. You cannot open each and every book at the same time. Topics are same, all right. You can gather everything at one book, either in the form of notes, either in the form of important points. Okay, and then you can study that, and at the time of revision, so there will be no needing of going through different type of books, opening different type of it will take a lot of time opening type of work. We don't have that much time while we are revising. Okay, so at that time you will be having only a single book to study, and you will be going each and every point of it like this. So this is how you are going to approach your study. The main point is clear your concepts. Okay, it will help you to solve exam questions. So that means that please do not rectify the exam questions. Those are repeated topics, but you have to clear your basic knowledge. You have to learn the basic knowledge behind that, because so that the question, however they manipulate the question, you are able to answer them. So this is the key point. Okay, so see, for SOP, definitely it is TAS. Okay, and for FOP, yes, the main book is illustrated, because in illustrated book they are giving the clinical like clinical features and everything, which SOP doesn't have that much. But to be honest, if I tell you that when they have some exam questions and we go through SOP books, so the answer you will get will be in SOP, not in illustrated. So that is why I recommend that when you are giving FOP, okay, go through illustrated. This is the main book, but give a read to SOP as well while solving the question, because the answer, most of the answers are present in SOP, and some of them in the clinical cases as well. So for your better understanding, you should go through these books. So once reading is nothing, right? The same topic you are going to read in illustrated, the same thing will be written in the SOP, right? Only some changes, maybe 1 point or 2 point, you can just add that in the illustrated, so it will be make your life easier, right? Okay, all right. So yes, so any other questions regarding study approach? Now I will be sharing some important chapters. Basically, these are the chapters. If you can see these clearly, these are our course chapters, course schedule. Some of you were asking about the course, that what we are doing in the course. So I am one of the mentor of the MRCPCH Part 1, and another mentor is Dr. Aksa. So we are taking the classes, which is most probably weekly classes. Okay. Yeah. So if you are giving both together, so illustrated will be, illustrated will be the main book, and for the basic one like physiology, embryology, pathology, anatomy, it's not present in illustrated book. Okay, for those you have to study SOP. Okay, so for some topics, because all of that embryology and physiology you not cannot dig out, and you cannot take out and put there. All right, so that is why for TES the SOP book, okay, and for FOP the illustrated book, and you can add points. Got it? Okay. So we are discussing, we are giving lectures, okay, on the weekly basis. The this schedule is for the students who are taking our course and might be taking this session as well. So we are doing cardiology in two parts: neurology, respiratory, GIT and hepatology. All right. And infection, part one and part two in divided, because these are main chapters. Okay. These are main chapters and big chapters. So it cannot be covered in single lecture. So we have two divided lectures for each part. Then endocrinology, we have two parts, and nephrology, we have two parts. So these are the main chapters, and which is divided into two parts. So half of them I am taking the lectures, then half of them Dr. Aksa Ali is taking the lectures, and we are making sure that we are covering each and every aspect of the study. Okay, we our lectures are based upon SOP, illustrated, okay, both. And coming to the guidelines, whatever guideline has been asked, we have included each and every guideline in that. Okay, and apart from that, the clinical cases as well. So if you take our course, you will be going through each and everything, okay, all together. Got it? Then after that, there are some minor chapters, okay, which is the hematology, oncology, coming to ethics, safeguarding, neonatology, musculoskeletal, emergency medicine. Then we have metabolic, psychiatry, adolescence health, palliative and pain management, pharmacology, accident and poisoning, dermatology, cardiac catheterization, ophthalmology, nutrition, growth and development disability, statistics, allergy and plus immunity, and genetics. Okay, so these are the chapters which we are, giving in our course in each lecture, and we are trying our best for, providing you all the stuff from SOP illustrated and clinical cases along with the guidelines. Yes, so embryology, physiology of peds, okay, yes, it is included in TAS exam, not asked in the FOP exam. It is asked in the TAS exam. So I will be showing you some of the example according to the chapters. Okay, so you will be, getting some idea that what type of topic are asked in FOP and what type of questions are asked in SOP. Sorry, TAS. All right. So yes, so these are the chapters we are going through. After that, coming to the example, so suppose if you are talking about cardiovascular system, okay, and if you are talking about test topics, that what are the test topics? Okay, our course, in the end of this session, I am going to give you link. All right. So even in the chat box, they have given you the contacts. Okay, you can contact them and you can join the course. Okay. Yes, we our lectures are based on the recordings. When each after each lecture, we have recordings, and that recording is available on the website. You can go through those recordings till you pass. Okay, so the access of the website is till you pass. So once you are in, you will be going out when you are pass. Okay, so yes, I will be discussing about our course features after 2-3 slides after discussing the topics according to the chapters. All right. Okay. Okay. So yes. So if we coming to the test topic, so what asked in the test topic is anatomy of the heart, embryology of the heart, physiology of the heart. Okay, coming to the fetal circulation and transitional changes after birth, congenital heart diseases. So if we talk about congenital heart diseases, that is also asked in the FOP. But in TAS exam, as I have told you that they are asking about the basics, right? So that is the pathophysiology. Sometimes they ask you about the ECG changes, syndromic association. So these are all are asked in the test topic. Cardiac catheterization they are asking, ECG components and associations they are asking, sinus tachycardia, VT. Okay, all the pathophysiologies. If they are asking about SVT and VT, they are not talking about that what will be the features or what will be the management. They are asking about like what is the pathophysiology, what is the defect. Okay, because this is test exam. Prolonged QT, pharmacology of heart failure. So these are all test topics. If you go through SOP, so you can go through these for test topics. Clinical cases. So I have just given an example, like what are the clinical cases related to test. So if you go through clinical cases of test book, so 5, 6, 7, 8. So all 4 of the clinical cases are related to the cardiovascular system. So when you are doing cardiovascular system, go through the topic, go through these clinical cases. So it will be easier for you. Okay. Now, if I talk about FOP topics, so in FOP topics, as I have told you, that they are asking more clinically, okay, not the basis. They are not going to ask you the pathophysiology in FOP, okay. They will give you the clinical scenarios related to the clinical features, okay, and they will ask you that what is the diagnosis of this. So, congenital heart disease, sign and symptoms and diagnosis, then heart failure, rheumatic fever, infective endocarditis. So, all these like along with the clinical features and diagnosis, you should know what is the specific investigation, you should know these. So these type of questions are related for the FOP topics, in which you can study the illustrated test book. Okay, so anything just go through SOP topic, and if in that something is new is there and it is not present in illustrated, and ask in the previous question, so you can add that. Coming to the clinical cases of FOP, so clinical cases will be 14 and 13. So if you go through the clinical cases book of FOP, so clinical case 14 and 13 is related to the CVS system. You can go through that. Okay, it will be easier to solve the questions. And if we talk about the important guidelines, so already I have told you that you don't need to go through each and every guideline. So in each system, we have important guidelines, that is infective endocarditis, VT or SVT. So these are the important guidelines of the cardiovascular system. Okay. Okay, coming to the neurology. Okay, so if we talk about neurology system, so what are the test topics for the neurology? So similarly for the cardiovascular, we have some basic topics for TAS. Okay, embryology of CNS, associated disorders, cranial nerves and defects, anatomy, physiology, CSF fluid drainage, associated disorder, interpretation of CSF fluid and analysis, sensory and motor pathways, upper and motor and lower motor neuron lesions. So what they are going to ask you about these? Only inheritance, pathophysiology, and sign and symptoms. Why sign and symptoms? Because see, FOP and TAS is sometimes overlapped. Okay, so they will give you scenario and give you the sign and symptoms, and then they will ask you that what is the inheritance of this and what is the pathophysiology of this. Dr. Priya, if you can mute, or if you are asking any question. Okay, thank you. Then, pathophysiology of epilepsy, anti-epileptic drugs along with their side effects. So most of, there are too many queries for me that what to study in TAS and what to study in FOP. So I have given, that is why I have included the slide to give you a brief review that what topics need to be done in TAS exam and what topics need to be done in FOP exam. So if we talk about the clinical cases of TAS, so these are the clinical cases which are for the neurology system, 33, 34, 42, and 43. So these are for the neurology system. We have 50 cases in each book for clinical cases of FOP as well and clinical cases of TAS as well. Okay. Now, FOP topics. So when we come to the FOP topics of neurology, so they are describing more like headaches. What are the type of headaches? And for the diagnosis, basically seizure and types of seizures. Okay, you have to study all of them for the diagnosis and management. Then again, upper motor neuron lesions and lower motor neuron lesions. So you should know the sign and symptoms because they are giving the scenarios and they are asking about the diagnosis, that what is the diagnosis of this. They might you ask about the investigation also. They must ask you about the management also, but not the investigations. All right. Okay, so some of the upper motor neuron lesions are CP, SMA, Charcot-Marie-Tooth, okay, GBS, and lower motor we have Bell's palsy, all right? Okay, so then ataxia, Frederick telangiectasia, ataxia, you should know the difference between them. Some of the neurocutaneous disorders like neurofibromatosis, tuberous sclerosis, Sturge-Weber syndrome. So these are the FOP topics. Clinical cases, these are the clinical cases. Okay, and guidelines, the important guidelines for the neurology system is type of seizures and management. This is very important because you should know each first line drug, second line drug, what are the lines of drug related to each type of seizure. You should know acute management of seizures, which is included in the emergency. Okay. Now, GID system, if we talk about GID system, so test topics for GID system is anatomy, physiology, histology of GID. Okay, then again, embryology of GID, GID secretion and functions, like what cells produce what. Okay, types of diarrhea. It's pathophysiology basically. They're not asking about to diagnose. Okay, they are asking about the pathophysiologies, vomiting and physiology, pathophysiology of esophageal atresia, duodenal atresia. So all the basics. Each topic for all the basics, because somebody asked me that can we leave any topic for exam? No, you cannot leave the topic for exam. You have to go through all, but you have to see that what comes in what exam, like so pathophysiology for test and clinical features and management for FOP. So this is how you are going to study for both of them. All right. Coming to the clinical cases of tests, we have 17 and 18, 19 for GIT topics. These are for the related to the GIT. Okay. So last, we have GIT system.
in GIT system, we have overlapping topics for FOP and TAS topics, which is dehydration and red flags, esophageal atresia and tracheoesophageal fistula, pyloric stenosis, difference between gastrochesis and exomphalis, Mickel's diverticulum, intussusception, malrotation, valvus, Hirschsprung disease. So these are the most important. These are the most important, which are repeatedly given in the FOP exam. They ask you, they give the scenarios, then they ask you that what is the diagnosis, or they might ask you directly that what is the investigation. So definitely you have to find out that this is the diagnosis. Then you are able to answer accordingly, right? Again, celiac disease, inflammatory bowel disease, again you have to diagnose the case. They might ask you the first line of investigation, because this is very important for the celiac and inflammatory bowel disease. Gastroesophageal reflux disease, abdominal pain and red flags, constipation. So these are all the important topics for FOP tasks and topics. So all of these topics are already covered in our course. Okay, we are our lectures are so prepared that each topic, okay, TAS exam also and FOP exam also. So each topic consisting of FOP topics as well and TAS exam as well, along with the we have covered the important points of the clinical cases as well and guidelines as well. Okay, so if you read our lectures, okay, I can say that you do not need to dig out the books for questions. All right. Okay, so these are the guidelines: celiac disease, inflammatory bowel disease, constipation, gastroesophageal reflux disease. So these are the important guidelines for the GIT system. So this was basically the brief review of some systems, so that you can get an idea that what type of questions we are getting in FOP and what type of topics we are getting in TAS and how to study. Okay, what should be included, like clinical cases and guidelines, how to assemble them. Okay, this is the way you are going to do that. Okay. So, yeah, so if I give you some information regarding our course. So, yes, I am a mentor, Dr. Jabeerah, and one of the mentor is Dr. Aksa Ali. And we are running batch, our new batch is starting from 7th Feb. We have already successfully, done our first batch. Okay, and we have done with our last lecture as well. Okay, so our new lecture is starting from 7th Feb, that is one day after. Yeah, so yeah, on since 7th Feb, I have shared the schedule as well. Okay, from 7th Feb, that when are our classes, at what time we are taking the classes, so you can go through that if you have any queries. For registration of the MRCPCH, this MedPrep online, you can register. You can contact them. Okay, the admin, if you want to take the course. uh, yeah. Okay, so yeah, so if I discuss the features that what we are giving. Contacting your admin. Okay. So yeah, I think there is a center in Islamabad. Yes, you can email RCPCH and you can ask them about your desired center of the desired country. Right now I'm in UK, so I can tell you that maybe yes, they have I think in Islamabad, but you can make sure emailing them, because they haven't provide the location of the centers on their websites. Okay, so you have to email them to ask that what centers they are providing you according to the country. Yes, getting seat is a bit a problem. You have to be very fast. Seat goes within seconds. I tell you that on the registration day, it's very difficult to get the seat. You have to be very fast for that. You cannot get a seat easily. You have to be fast for that. Keep refreshing the page and everything. Okay, so yes, if we talk about that, what we are doing in our course, we have 30 to 32 live interactive lectures, okay, by us. We will be covering all the chapters, all right. Then we will be giving you recording and PDF files of our lectures, like the recordings of our lectures and the PDF file for study. You cannot download those files, but you can use them on the website. Okay, and the access will be given to you on the website. You can reach to the website anytime when you want. Okay, and then each system test will be taken on website based on recalls. After each lecture, we will be providing you topic test for your to checking your knowledge. Okay, and you can check yourself as well that how much you know. Okay, so those those topic tests are based on recalls, previous questions. Okay, then system-wise recalls will be discussed in private study group as well, because on the demand of students, we have started this, that after each lecture, we will be, discussing the previous question as well in the Telegram group or WhatsApp group, whatever group is preferred. So we will be discussing that, okay, either on the regular basis or leaving one day. Then so that we can cover the theory part, the lectures also, and going through towards the recalls also. So in this way we will be able to cover both of them. Okay, so in the end that your preparation will be definitely good. Okay, after completing all of the lectures and the topic test, you will be provided by the grand mock exam before your actual exam. Okay, so that you can evaluate yourself and we can evaluate that how you studied and everything. So any queries you will be having, we will be there on the group to answer you at any time. Okay, so these are our regular course feature. So if you want to get registered, you can register and contact the admin for the registration. Okay, so for now, those who are taking our session, okay, so there is a discount for 24 hours. So if you take our course, so there is £100 off. Okay, so you can contact the admin, all right, and get the course. So because we are starting on 7th of February, and as sooner you start, it will be more beneficial for you, because you can go through, because whenever there is backlog of the lecture, so it is difficult to go through the lectures, right? So you can take the lectures from now, so it will be more easier for you, right? Okay, so the tests are uploaded on the website. Okay, and whenever like you are done with your reading, so it's upon you that you are done your one chapter, and then you go to the website and take those tests. Okay, and then you can take it anytime you want. All right, on the website we have our own MedPrep online website. Okay, the access of which is given to the students when they take the course. Okay. Okay, so Dr. Vish, basically this session was about FOP and TAS. For AKP, yes, we have mentors for AKP as well, and we have the session for AKP. So you can see that, or you can ask admin to, give you the link for the AKP orientation session. All right. Okay, you're welcome. So after this, if you have any question, you may ask. This is the end of our session. Okay, so if any question, any more question you people have, so I am here to answer you for the next 5 minutes. You are welcome, Dr. Shaida. Okay, to be honest, I would say that if you do the previous questions and when you go through each and every topic, so past tense is not that, mandatory, because you are not going to get exact questions from the past test. All right, just, you should clear your knowledge, okay, and clear your concept from the books, from the guidelines, from the clinical cases. You can ace the exam easily. Yes, OAT is mandatory after clearing MRCPCH. Although this is the question for the clinical exam, but yes, OAT is mandatory after clearing MRCPCH if you want to work in UK. Without OAT exam, you cannot work in UK. You're welcome. Any more questions or shall I leave? Okay. Guideline of uploading degree on RCPCH portal, as I've already made account and got the RCPCH number, but I haven't uploaded degree. Okay. So, doctor, in which group you are in WhatsApp group or in Telegram group? So, I have already link of that. Dr. Aksa have made it. Okay. So, we'll share that again. Okay, Dr. Khulud, we'll share that again. You're welcome. So, any more questions? So, shall I leave now? Okay. Okay. Thank you so much. I am leaving now.